Okay. Good morning, class. Today's topic is manual muscle testing. So, introduction is what is muscle strength testing? So, it refers to the determination of strength of a muscle or a muscle group, and it doesn't reflect muscle function. Test is completely based on effective performance of movement, manual resistance, and gravity. Okay, so muscle strength testing its purpose are diagnostic, examine the improvement or deterioration of patient status over time, predictive or prognostic tool, determine the extent of strength loss, outcome measure in clinical research, and determine the need of compensatory measures or assistive devices. It helps in the formulation of treatment plan and it evaluates the effectiveness of the treatment. So muscle strength versus endurance. What is muscle strength? It is the production of force, voluntary exertion, one maximal effect and result in isotonic or isometric contractions and gross indicator of functional ability. Whereas muscle endurance is repetitive contractions of muscles and maintenance of isometric contractions. Reason behind muscle weakness are any reduction of normal ability of muscle to generate force. Causes are muscle strength, pain, reflex inhibition, nerve root lesion, upper motor nerve lesions, tendon pathologies, avulsion and ruptures, and prolonged disuse, immobilization, psychological overrelay. The main components of uh, test are test performance evaluation of muscle strength. Then test performance muscle it includes muscle origin, insertion and action, function of participant muscle, pattern of substitution, ability to detect contractile activity, and ability to palpate muscle or tendon, ability to detect atrophy, and recognition of abnormal position or movement. Awareness of deviation from normal range of motion, laxity or deformities, and identify muscle with the same innervation, relationship of diagnosis to sequence and extent of test, ability to modify test procedures as necessary, effect of fatigue, effect of sensory loss and movement. Evaluation of muscle strength to detect the substitution whenever weakness exists, accurate grading of muscle strength. Basic consideration include observation, palpation, positioning, stabilization, resistance, validity, and reliability. Observation and palpation include observe the size and contour of muscle, palpate contractile tissue. Positioning includes patient's comfort, depends partially on the effect of gravity. Use position that offer the best fixation of the body as a whole. Use anti-gravity position as applicable and two joint muscles. Stabilization includes proximal attachment of muscles used to isolate the desired action to a specific joint. Stabilize the part proximal to the part being tested. Stabilization of proximal attachment of the muscle through muscle tension, gravitational pull, external pressure from manual stabilization. Resistance. Force that acts in the opposition to a contracting muscle applied in the direction opposite to the line of pull must never be sudden or jerky, applied gradually but not too slowly to allow the patient to get set and hold. Applied uniformly, long lever arms and versus short lever arms. Break test versus active resistance test. What is break test? Break test is resistance applied at the end range. Patient is asked to hold the part at a point and examiner breaks it. What is active resistance test? It is Application of manual resistance against actively contracting muscles. Examiner will be gradually increase resistance until maximum tolerance. Validity and reliability. It includes inherent limitation, which is affect the types of two muscle contraction and rate of tension development, affected by difference in testing methods, magnitude of resistance, force application, point of application, speed. Factors are patient factor, therapist factor, environmental factors, and others. Then patient factor, age, gender, pain, fatigue, lower motor neuron disease, and spasticity, where therapist factors are experience, manner, and content of instruction, and interaction with the patient. Then environmental factors are temperature and distractions. Other factors includes muscle factor, psychological factors, methodological factors. Methods are muscle strength testing. Three methods are instrumental, manual, and functional. There is a two scale for MMT, Daniel and Worthingham's scale and Kendall scales. What is the being tested? Motion and individual muscle resistance gradually increasing, maximum at the end of the ration, and in Kendall, maximum at the mid range. Type of contraction in Daniel's scale, concentric to isometric, and in Kendall's scale, isometric. Method of grading. Daniel scale include numerical or qualitative score, and Kendall's scale include percentage. Daniels and Worthingham's MMT criteria used in assigning of a muscle grade. Sorry. Factors considered include the following: subjective factors, objective factors, and other factors. Subjective factors include examiner's impression of the amount of resistance to give before the actual examination and amount of resistance that the patient tolerates during the actual test. Objective factors includes ability of the patient to move the body part against gravity and ability of a patient to complete full range of motion. Then ability of a patient to hold the position once at the end of the range of the motion. Other factors includes amount of manual resistance applied, ability of a muscle to move the part through the full range of motion, effect of gravity, evidence of contraction. Daniels and Worthingham's MMT grading are normal range N or 5, full range against maximum resistance and gravity. Second, good, G or 4, full range against moderate resistance and gravity, which gives or yield at the end of the range given maximum resistance. Functional threshold for the lower extremity. Pair plus F plus or 3. Full range against mild resistance and gravity. It gives or yield to some extent at the end of its range given moderate or maximum resistance. For user of orthosis, pair F or 3. Full range against gravity gives at the end of the range against mild resistance. Functional threshold for the upper extremity. Next, Daniels and Worthingham's MMT grading. Next, poor, P or 2. Full range, gravity, eliminated plane, poor minus P or 2. Partial range, gravity eliminated, then press T or 1. It includes visible or palpable contractions, no movement of the body part, 0. No visible or palpable contraction. How to document it? All muscle of the trunk and extremities are closely graded F by X 5 by 5 except shoulder adductors 3 by 5, knee flexors 3 by 5. Significance. Muscle weakness due to deconditioning. Break test. All the muscle of the wrist and hand are grossly graded 5 by 5 except wrist flexors 4 by 5, radial deviators 4 by 5 means 10 degree. Significance. Muscle weakness due to pain brought about by the reflex inhibition. Range test. All of the muscle of lower limb are grossly graded as 5 by 5 except for hip extensors 4 by 5 includes 0 to 90 degree, hip adductors 4 by 5 includes 0 to 20 degrees range of motion. Its significance, muscle weakness due to prolonged immobilization. Range test was used to contractures of the hip flexors and adductors. Daniels and Worthingham's MMT limitations are presence of upper motor neuron lesions, spasticity, presence of joint instability due to chronic placidity, presence of severe contractures. Daniel and Worthingham's MMT areas conditions that require modifications which are hand, toes, face, neck, weight bearing muscles, children. Hand and toes. Weight is minimal, so effect of gravity is unimportant and need not to be considered. Test in either gravity eliminated or gravity assisted position. Gradings are 5 equals to full range with maximum resistance, 4 equals to full range with modified resistance. 3 includes full range of motion, whether gravity eliminated or assisted plan. 2 partial range of motion, whether gravity eliminated or assisted. 1 palpable or observable flicker of muscle contractions. Face. Not always practical or possible to palpate muscles, apply resistance or position the patient. So here is the grading N by F, which includes N or light impairment, complete test movement with ease and control. Second, WF, W by F, moderate impairment with affected degree of active motions, performance with performance test with difficulties, and by F, severe impairment and minimal muscle contraction, then 0, absent. Then neck. Using gravity eliminated position when testing for neck flexion and extension is impractical. A muscle grade of 2 is assigned when the patient can complete partial range of motion while in gravity resisted position. Then weight bearing muscles. To be resisted maximal, some muscle require the assistance of body weight. For gastrocnemius and soleus, children may not cooperate with standard MMT procedures. 2 to 5 years or can initiate the test position, but they can't sustain it because they don't understand the concept of exerting counterforce versus examiner's resistance. It needs to be modified for 4 to 6-year-old children. Then Daniel and Worthingham's modified test. It includes combined tests for extremities, quick test, squatting, walking on heel and toes, break test. Movement cannot be totally prevented but can be minimized by telling the patient, don't let me move you. Then evaluation of functional activities, donning and doffing, gripping the examiner's hand. Daniels and Worthingham's consideration always start the test at grade 3 in case a movement needs to be tested in the non-standard position. Indicate the position used. Then, when in doubt about the grade assigned to a muscle group, place beside the grade. Question mark. Note, special cases MMT of finger or toes or upper motor neuron lesion, freedom from discomfort or pain, quit the non-distracting, well-ventilated environment, adequately firm wide plinth with adjustable height, minimal position changes, presence of all materials need for the test. Instrumented muscle testing. Advantages are increase the level of accuracy and reliability of muscle strength testing. Instruments device includes cable, tensiometer, strain gauge, handheld dynamometer, modified sphygmonanometer, grip strength dynamometer, then pinch meter. Instrumented muscle testing limitations are measure isometric strength only, not useful for testing trunk strength, and some consideration of instrumented muscle testing are reliability is reasonable, important to standardize strength, instruments are not interchangeable. Then dynamic muscle testing makes more sense since muscle function dynamically. Machine use isokinetic machines. Its limitations are validity has not yet been established, movement occurring at constant speed is artificial, position and movement contents are not realistic. Functional muscle testing utilized in case when muscle strength cannot be tested by MMT, presence of spasticity and flaccidity, patient with poor comprehension, patient who are unable to follow instructions, observation and description of certain movements or activities of the patient.